The last subject of the day is a $600 billion swindle. Study makes case to abolish Medicare Advantage. People, how much is it going to take for us to vote anybody who supports Medicare Advantage out of office? It's a fraud. It is your money being taken away by a few rich plutocrats, and they give you the impression that they're doing good. And for anybody that says, oh, I love my Medicare Advantage, I'm going to say it bluntly, stop being selfish. And this is what I mean. This is what I mean. You are doing fine with Medicare Advantage now. Your plan may be doing fine. But as soon as your plan goes south, which it ultimately will, by definition, as the people who comprise your plan get sicker, that plan will eventually be priced out of the market. Think about this. If Medicare Advantage was so good, you would not have to resign every year and likely change policies when that plan is no longer cost effective for not you, not your doctor, but for the plutocrats on the top, the oligarchs, the executives. Anyway, a new academic analysis published Monday in JAMA Internal Medicine details the enormous sums that privatized Medicare Advantage plans have cost U.S. taxpayers in recent years and calls for the abolition of the program, which has been massively profitable for the insurance giants that dominate it. Citing the nonpartisan Medicare Payment Advisory Commission, the paper notes that Medicare Advantage plans have overcharged the federal government to the tune of $612 billion since 2007 and $82 billion last year alone. Medicare Advantage, now used by more than half of the eligible Medicare population, utilize a range of tactics to reap larger payments from the federal government, which provides insurers a lump sum for each Medicare Advantage payment. The size of the payment depends on the enrollee's health, which MA plans are notorious for portraying as worse than it is in order to receive heftier government payments. In other words, they cheat. Paradoxically, despite those overpayments, Medicare Advantage plans spend 9% less on medical services than fee-for-service Medicare spends for comparable enrollees, reads the new study. If Medicare Advantage plan pays for less care, where do the overpayments go? Some pay for supplementary benefits, although plans do not disclose how much they spend on them, and Medicare Advantage enrollees did not get significantly more dental care or incur lower out-of-pocket dental costs than those in the FFS standard Medicare. Instead, overhead and profit eats up the lion's share. Repeat, overhead and profit eats it up. The study's authors estimate that Medicare Advantage plans overhead for 2007 to 2024 was $592 billion, which is equivalent to 97% of taxpayers' $612 billion overpayments to them during that period. Dr. Adams Gaffey, an assistant professor of medicine at Harvard Medical School and the lead author of the new study, said in a statement that Medicare Advantage is a bad deal for taxpayers. Money that could be used to eliminate all co-payments or shore up Medicare's trust fund is instead lining the insurer's pocket, and said Gaffney, and the private insurers keep Medicare Advantage enrollees from getting needed care by erecting bureaucratic hurdles like prior authorizations and payment denials. Gaffney and study co-authors Dr. Stephanie Woodhandler and David Himmelstein, co-founders of Physicians for a National Health Program, argue based on their examination of Medicare Advantage decades-long history that the time has come to declare Medicare Advantage a failed, I repeat, a failed experiment and abolish it. Medicare Advantage plans have in effect stolen hundreds of billions from taxpayers, said Himmelstein, a lecturer at Harvard Medical School and a research associate at the consumer advocacy group Public Citizen. And the private plan scheme also raised seniors' Part B Medicare premiums, even if seniors who don't choose to enroll in the Medicare Advantage or subsidize the private plan's profit. The study authors' observation that the elimination of Medicare Advantage would allow the federal government to use roughly $88 billion in estimated Medicare Advantage overpayments for the coming year to instead upgrade benefits for all Medicare beneficiaries. Traditional Medicare typically does not cover dental, vision, or hearing services, which often leads the people to choose Medicare Advantage. A smarter, thriftier way to expand benefits and lower out-of-pocket costs is possible for all Medicare beneficiaries, but first, we must eliminate Medicare Advantage and double down on traditional Medicare, covering all enrollees in an expanded and improved Medicare program. The analysis concludes that would be a good deal for patients, taxpayers, and think about it. Think about your sanity. Think about not having to do all those pre-authorizations. Think about the goodness of that. But no, Wendell Potter, which we interviewed here, I interviewed Wendell Potter, who was an executive for the insurance companies who came and blew the whistle about how they stole our money. A former insurance executive who has become a trenchant critic of Medicare Advantage told Common Dreams that he agrees with the study authors that MA should be eliminated, Medicare Advantage. Not only has it never saved taxpayer a dime since it was created during the George Bush administration, but it has cost us $592 billion over the last 17 years because of the high administrative costs inherent in the program and the way insurers have rigged the system to get paid excessively every year, said Potter, president of the Center for Health and Democracy, and we've had him here several times. The program is so entrenched, and the companies have so much political influence over Democrats as well as Republicans through campaign contributions and lobbying, that eliminating the program will be a heavy lift, at least in the near term, Potter said. That means that proposals to reform MA that addresses overpayments and abuses like prior authorizations are essential and important to reform advocates to support. Let me tell you something, folks. The biggest the biggest grifters, the biggest thieves, the biggest welfare recipients in this country has nothing to do with those poor people we like to give a hard time to, those poor people we like to look down at, those people that are asking for a little bit of assistance from the government. That's not where most of our money is stolen, or tax dollars. It's the corporations that have gotten big tax cuts. At the same time, they're ripping us off by taking Medicare money for Medicare Advantage and not giving the service, having pre-authorizations and getting people killed so that they can continue to have their yachts. Folks, we cannot tolerate that. We cannot keep doing that. We cannot keep doing that. It's a shame. It's a sham.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.